In the past 4 months, the world has been struggling to come to terms with an unprecedented public health emergency. The coronavirus disease, COVID-19, according to the World Health Organization, has within that time wreaked untold havoc on humanity. And to underscore its devastating impact, the number of infections globally will be crossing the 1 million mark in the next few days, unfortunately. Already more than 45,000 people have died from the virus, and to a large extent, Africa has been on the periphery of those staggering figures, even though it has to be noted that the number of infections and deaths on the continent have grown exponentially from the date of our first index case, which was in Egypt in February. Now, South Africa, Algeria, Ghana and Nigeria appear to be on the front line more than anyone else on the continent. Governments of the 54 countries and the private sector across Africa as well have been deploying time, energy and also financial resources in a bid to avert a possible explosion of the outbreak, albeit with varied levels of success. But against the backdrop of the traditional underlying socio-political and economic problems of the continent, situations that have progressively led to infrastructure decay and sometimes a complete lack of it at all, questions are being raised now by analysts regarding the capacity of Africa to deal with a worst-case possible scenario. So we're now going to spend some time to look at this subject with Ambassador Segun Akinsanya, a former Nigerian ambassador to Ethiopia and also permanent representative to the African Union and the United Nations Economic Commission for Africa. He's currently the first vice president of the Association of Retired Career Ambassadors of Nigeria. Welcome to the program, Ambassador. Good morning, and thank you for joining us.
Ambassador Akinsanya, good morning.
Yeah, thank you very much. Good morning, Ruben and Leila.
Yes, well,
thank you.
I'm sure you listened to Leila's introduction. The entire world is under siege, and Africa has not been left out in the face of the coronavirus pandemic. But what is the value of diplomacy in this, both at the bilateral levels and at the multilateral levels? The African Union, for example, has set up an Africa joint intervention on COVID-19. And ECOWAS also recently set up a task force on COVID-19 and also a committee on COVID-19 with guidelines for member states. Now, these organizations, both continental and regional, is there a role really that they can play apart from just issuing press releases?
Oh, certainly, Ruben. What we are seeing, which Antonio Guterres yesterday referred to as one of the greatest challenges, global challenges since the Second World War, necessitates multidimensional answers. And Africa is plagued with a lot of problems. Peace and security issues, governance issues, and which has now been exacerbated by the terrorism, insurgency, and of course, the coronavirus pandemic that has hit the world to its foundations with humanitarian problems. And for us in Nigeria, action is being taken at various levels. Our president was in the air to be able to lay the grounds for what we should be doing, and there are regular briefings to be able to chart the way forward to really curb the spread. You asked the issue about the African level. Africa has a lot of problems, and responses, of course, varies from country to country. But there's certain uniformity on the universality of action that has to be taken collectively or bilaterally. Having been a global issue, it's important that Africa as a continent responds to it. And this happens, you know, even at the last AU meeting, that it was a lot of efforts were made to really have international response. Also at the level of contemporary parallel African organizations. The ECA, at their last meeting also, and also in the meeting of the Council of Ministers, Finance Ministers, addressed this issue. So it all shows the importance that Africa attaches to this issue and the need to be able to boost capacity, to be able to look at what can be done to cope, because it's a question of life and death. The capacity also varies from country to country, but this is an area where there needs to be, all hands should be on deck, and that is what we are seeing in Nigeria, that coalitions, the private sector, and all, professional bodies, and even the think tanks, because the UN, at the moment, is doing African dialogue on the future that we want and what Africa needs, the UN that Africa needs. So Guterres' leadership that was displayed in his call for spontaneous actions to be able for the international community to deal with this situation is very apt. And this will complement a lot of efforts that has been done at the bilateral level to fight this cost. Because it is only when we have peace that development will be enhanced. And now this has been, added to this now, the issue of death, the issue of the pandemic, which needs to be addressed, because it is when we are alive that we should be able to address quite a lot of other problems that Africa faces. DRC has a lot of problems. Libya, there are conflicts. Sudan, there are conflicts. Even back home here in Nigeria, we have a lot of security challenges. But at the same time, Africa has a lot of opportunities. What this thing has shown us is that we have to turn these challenges to opportunities in the future.
Certainly, Ambassador. I couldn't agree with you more on that point of turning challenges into opportunities in the future. And I'd like us to look into Africa, supporting Africa a bit more now. Now, of course, we know we're ridden with several problems that make it hard for us to actually cope with a situation like this, which is why there's a lot of fear around a serious outbreak across the continent, and we're being warned by the Director General of the WHO, the Secretary General of the United Nations, etc. But let's take a situation like Italy and Germany, for example, whereby Germany airlifted patients from Italy over to Germany to alleviate some of Italy's pain because they had more capacity to do so. Are there any options across the continent right now for ways in which African countries can help each other in different, unique ways? Is there anything that you can think of or any suggestions that you can give? Because I think a lot of we to African problems, and we have quite dire statistics and situations right now. I'm looking at one in front of me about the fact that we have 350 ICUs in Nigeria to 200 million people. So how can Africa help Africa right now?
Well, I think that's a very good question. African solutions to African problems is no longer a jargon. It's a program of action. And there have been quite a lot of experiences. I recall that when I was in the African Union and we were looking at capacity building for Sudan, there was this element of sourcing out experts from Africa to be able to help Sudan to grapple with its capacity problems. That was done. In the case of the fight against Ebola, I was also at the African Union at that time, and I saw the AU providing opportunities for volunteers. or state representatives, the healthcare people, to be able to go to countries like Sierra Leone, Liberia, and others. So it is doable. But of course, the problem that we are facing as a pandemic requires putting all our resources, all our expertise into play. Of course, if any African country asks, the government of Nigeria will consider it. But of course, this is a problem that is global. It's even addressing us, our ability to be able to cope with the amount of the problem that we have is one. So while I don't doubt the capacity of African countries to be each other's keeper, but this is a situation that we ourselves, we hear a lot of the briefings every day about how this spread is expanding. We have the highest number yesterday, 35. We are building isolation centers. We are mobilizing our own staff at all levels. And we are also constituting what I would call, Nigeria Incorporated, in the sense that we are now having various coalitions, even think tanks. I was hearing at Peter's side yesterday, mobilizing some think tanks, of which only one is a medical doctor. So all hands are on deck to be able to trace these issues at the various national levels, but not leaving out the possibility of responses from individual African countries to be able to ask. But AU has a very important role to do. Resources is very key. Equipment, pharmaceuticals, the testing kits are very important. I was happy to hear the foreign minister at one of the briefings about some few days ago that Nigeria is making requests, even sharing experiences of what other people are doing, because at this time, even Europe, most of our items goes to Europe. But within the Euro line, they have their own problems. Italy, Germany, even United States, not to talk about Russia, that where it all emanated from. So everybody is now trying to fight this course at the national level because of the rising of the pandemic. So why I will not deliver the possibility, but what Nigeria is concentrating, admiration of quite a lot of people, both in terms of the economic dimensions, in part of providing stimulus, and at the same time, mobilizing all our health care capacity to be able to deal with this situation. I think this is the priority that we must face now.
Well,
Thank
Ambassador, I like your review of efforts at the national level in Nigeria so far. But what are those things that you think that the Nigerian government should still do, both at the federal government level and at the state level? In Lagos here, we have had 2 days of lockdown, and we have seen all the measures that have been taken by government. Do you think those measures are adequate, or there are some missing links and suggestions that you would like to offer, given your experience?
Well, yeah, thank you. I mean, these are not normal times. And while a lot of efforts were being put up by government, it's a learning curve. As they review the situation on the ground, as they listen to reactions, they are trying to provide opportunities to be able to improve on the present standards. Well, social distancing is now the stage. And apart from, the closure of the borders, the closure of the international airports, and also spreading out the protocols, hygienic and others, and also the testing. Because it appears that the more the testing that we are able to do, the more that we are now seeing the level of the spread over. But what I think it does, a lot needs to be done in terms to be able to mitigate these effects of the lockdown. It's important that the life is a question of life and death, and we need to preserve lives. But of course, we know the situation of Nigerians, and I believe that the government needs to address more in terms of those stimulus. To be able to reach the greatest number is like the Bentham's utilitarianism, the greatest good for the greatest number. The central bank stimulus will address some issues. The cash grants, the transfers will address the poor of the poor. But at the same time, it's something that has to be on a continuous basis to be able to reach out. Because there are quite a lot of the delinquents. There are people in the prison. There are people who don't even have a house, and they live outside. So if they are kept in, what is to be done? I think all this will require some adjustments and to be able to deal with the issue holistically.
Thank you, Ambassador, and I am so glad that you brought utilitarianism into this and the greatest good for the greatest number, which unfortunately is often ignored when we look at societal problems that we're facing and trying to find solutions for them. Ambassador, I don't want us to dwell on past problems, but there is something that I do.
Can you please start again, because I'm losing you.
Sure, Ambassador.
Could you start off again to be able to?
Can you hear us now?
Yes, it's better now.
Great. Okay, so I would like us to go back to something. I don't really want us to dwell on problems, but I would like us to discuss the amount of time that it took before Nigeria did put a travel ban on high-risk countries. I'm bringing this in because if the tables were turned and the COVID-19 outbreak had its epicenter here in Africa, the rest of the world, the West in particular, would have shut us off immediately. Now, basic international relations should often suggest reciprocity, and it kind of suggests that this is a continuous inferiority complex more than anything that was said by governments, be it WHO guidelines, public health policy guidelines. It kind of does suggest more of an inferiority complex that led to us closing our borders so late. What is your take on that and the way we should have responded with basic international relations to that in the first place?
Well, I would not say, Lila, that it's more of inferiority complex. We closed our border since August last year, and even though the emphasis was more on the movement,
I'm talking about the border closure with the COVID-19 outbreak, Ambassador, not the closure of our land borders with regards to...
Okay. Well, that's all right. I mean, I've also had comments along those lines to say that we will have done that earlier, or that it could have been a total lockdown. But of course, even the countries that are more experienced, that have more capacity, that are more focused than us, have had quite a lot of opportunities to learn in the process. So the whole thing, we can say that there is the element of delay or lack of spontaneous action to be able to respond to this pandemic globally. But of course, you see, it is something that I think that from what the reports that we have at the press briefings by the Presidential Task Force, is that it's a movement. I mean, we started with an Italian that came and it was tested positive, and in the process, it continues. And the Lagos state government and other state governments are up to be able to address these issues, and the number is rising. So I think there are step-by-step issues. I would not say that it's sort of inferiority complex, but of course it's like it's a learning curve, and there are improvements by the day. Now, we all know the situation of our health care system. The infrastructural decay, quite a lot of problems that the government is addressing itself to. But it came, I mean, at the time, people thought it was not possible in Nigeria, but it has now been seen to be a reality. And I think since the Mr. President gave his speech. And there is the lockdown. And I think there have been a gradual improvement on the interventions. But there's room for improvement. I will agree with that. But what is important is the resources. And that is where the international call, the clearing call, the leadership call by United Nations Secretary General Antonio Guterres is very relevant here. A lot of risks are involved. A lot of things are being done by government in trying to address other fundamental issues. But this has now overridden that. We all know the international situation regarding the oil prices, which is below our benchmark, and to the extent that a lot of efforts are now being done at all levels to now respond, even in taking another look at our budget. And the efforts of the private sector, individual and corporate organizations has been impressive. If you compare this to other African countries that do not have the wherewithal, of course, we will say that Nigeria is far ahead of them. But I believe that the government is having its hands on the ball. A lot still has to be done. It is not uhuru yet. The health of every Nigerian is important, both the old and the young, the rich and the poor. And it's a wake-up call for us to be able to now look at our health systems and see what we need to do to improve on the livelihood of others.
Well, definitely there's a lot that can still be done. And I quite agree with you that international collaboration and cooperation will be necessary in dealing with this challenge that the world faces. There have been many theories about COVID-19, even about pandemics in general. But if you look at it, you see that over a century of medical progress and scientific progress, we're still having issues with pandemics. And these pandemics are often unanticipated. Even now, even scientists are confused. What do you think is responsible for this? Is it human hubris, the way we live, the way we engage with the world, or is it the limits of scientific knowledge, a failure of science, perhaps, that is responsible for these pandemics, one after the other?
From my own perspectives, of course, there are regular scientific feats. The researchers are on the prowl. The researchers are daily looking at how to improve on the livelihood of the people. But of course, it also has to do with the psyche of the Africans, our modes of living, relative to the available opportunities to be able to address these issues. I believe one lesson that we will learn from this is that dependence on foreign intervention for our health issues, it has to give way to the development of our own capacity, our own capability, to be able to address basic issues like health for these people. One of my greatest admirers in philosophy is Bentham's, providing the greatest number for the greatest number of people. I think it's one of the issues lessons that we need to learn, that we have to build our own infrastructure, we have to care for our people, we shouldn't put our emphasis on that at the slighted opportunities, or there are better opportunities elsewhere, there are better health care elsewhere, at the detriment of the millions of Nigerians that need care. I think this is one of the greatest lessons that we also need to hear. Also, we need to move along the lines of the balancing of economic issues, the well-being of Nigerians, education, infrastructural development, And of course, security. The African Union at their last conference has as their theme, silencing the guns as part of the Agenda 2063 and paving way for economic development. It's because of the realization that there cannot be development without peace, and there cannot be peace without development. So what I think, there are lessons that we are learning, and I'm happy that our president has put in place a presidential task force. He has already established a COVID-19 committee, NEC committee that the vice president is heading, to be able to think ahead, to think aloud, use all the resources that we have. And at a time, and I'm sure that African countries and others will request for our own assistance, which they have done in the past. But at the moment, all hands should be on deck to be able to address this issue. Is it a question of our lifestyle? The issue of distancing, for instance. I know that it's a difficulty for some people to even stay at home. They are always on the run. They are always out to do one thing or the other. But of course, maybe this will revert to a recourse to family values. To say that we have to look at our style of life. Look at the facilities that is available in our country relative to what happens elsewhere. And to be able to develop on those attributes, improve on our values, to be able to forge ahead. I hope we'll be able to flatten the curve. I hope Nigeria will be better for it, because I'm optimistic. All this is turning our our challenges into opportunities, and using some of the pitfalls to be able to develop our industries. I heard the governor of Ogun State, my state, last week, talking about they have now gone into production of hand sanitizers. And I think these are some of the things that we should be inward-looking to be able to see that, well, this is a wake-up call. There's international, there's need for international response. There's the need for continental response. There's also the need for us to be able to develop our capacity to be able to deal with this pandemic for the future.
Certainly, Ambassador. And as we round up the conversation very quickly, I really like your optimism, because a lot of experts are saying that, yes, it's time for Africa to respond, restore, and then restart. Just very quickly, Professor Kingsley Moghalu came out to say that he prays the oil stays at $20 a barrel. Would you share this viewpoint?
Well, that would not be good for us. As somebody said, the recession is back. The issue is that when do we get out of the recession? I pray it doesn't get to that. But what I would say is that it is also a wake-up call for our government to pursue with vigor the issue of diversification.
Thank you, Ambassador.
It's only that when there is this, the diversification must be holistic.
Thank you.
Thank you for joining us this morning on The Morning Show.
Yes.
Thank you very much indeed.